I am not a medical professional. If you believe you are experiencing a condition, please speak with your medical provider. My goal as a full spectrum holistic reproductive practitioner is to bring awareness to different conditions and how holistic care can support the body to heal. Let's talk about preeclampsia. Let's talk what is preeclampsia. This is a very serious condition that can have many different signs, symptoms, and risk factors. This is a condition that is associated with high blood pressure and can affect different organs. As mentioned, preeclampsia can be very serious and can occur when the blood pressure rises too high after 20 weeks into pregnancy and can occur after pregnancy. If this condition develops before 34 weeks of pregnancy, it is known as early onset preeclampsia. Our blood puts pressure on the arteries, which in return creates the blood pressure. Signs and symptoms of preeclampsia. Speak with your medical professional or your doctor immediately if you notice any of these signs and symptoms. This condition can develop without being able to notice that it has even developed. So given that, some of the symptoms can include swelling of the face or hands, a headache that will not go away, seeing spots or changes in the vision, so blurry vision, pain in the upper abdomen or shoulder area, nausea and vomiting in the second half of pregnancy, sudden weight gain, and difficulty breathing. If this condition worsens, severe features may start to develop, such as a low number of platelets in the blood, abnormal kidney or liver function, pain in the upper abdomen, changes in the vision, fluid in the lungs, and severe headaches. What is the cause of preeclampsia? Unfortunately, it is unknown why many individuals will develop this condition throughout and after pregnancy. Pregnancy and preeclampsia. If diagnosed with this condition, an early delivery may be needed. If considering pregnancy and have high blood pressure, speak with your medical professional so that they can get an understanding of how severe or high your blood pressure may be. Other tests may be performed to check the functioning of the kidneys and heart, and if taking any medications, they should all be reviewed. Labor should take place in the hospital rather than an at-home birth, as this is a serious condition and many different complications can arise. Preeclampsia can cut off the nutrients and oxygen to the baby. It can also create a higher risk for a premature birth. It increases the risk of stillbirths and can affect the birth weight. How is preeclampsia diagnosed? This condition can be diagnosed after 20 weeks of pregnancy. There are two different categories that your doctor or medical professional may list their patient under. So this would be a high risk or a moderate risk. Your medical professional should closely monitor the blood pressure during the prenatal visits, as a high reading could be the first sign of preeclampsia. There are some other tests that your medical professional may want to do, such as a urine test to check for protein, and testing on the liver and kidneys to make sure that they are functioning properly and they will want to test the platelets in the blood. So what is considered high risk? This can be diagnosed when an individual has had preeclampsia in the past, chronic hypertension, kidney disease, diabetes mellitus, autoimmune conditions, being pregnant with more than one fetus, and if the patient shows multiple moderate risk signs. So then what is considered a moderate risk? Some of the reasons this condition can be diagnosed as moderate risk would include becoming pregnant for the first time or conceiving more than 10 years after the last pregnancy, if the body mass index, so the BMI, is over 30, if there is a family history of having preeclampsia, being older than 35, complications with previous pregnancies, IVF, a history of high blood pressure, a history of autoimmune diseases such as diabetes, the location where the placenta implants, and being pregnant with multiples, so again, twins, triplets, etc. Treatment and management for preeclampsia. Your medical professional will explain the best way to manage this condition, and depending on the severity of the condition, the individual may be treated within the hospital or as an outpatient. At 37 weeks of gestation, you and your medical professional will likely start to talk about different delivery options. A vaginal birth is still possible. However, if testing shows that the baby is not doing well, labor may need to be induced. If there are any complications during labor, a cesarean may need to be performed. If you are less than 34 weeks pregnant and the condition seems stable, labor may be prolonged for a few days, which can be very helpful. And there is no cure for this condition other than delivering the baby. If you are not close to term, there may be some ways to help manage this condition by resting as much as possible. Bed rest may be suggested, and testing will be more frequent. If the case is severe enough, but it is too early to give birth, the patient may be required to stay in the hospital for bed rest, and this will allow the medical professionals to administer different medications to lower the blood pressure and to prevent seizures. A steroid shot may also be administered, and this is to help the baby's lungs prepare for an early birth. I am a full spectrum holistic reproductive practitioner. So this means I am a doula, a reflexologist, and a Reiki practitioner with levels 1 and 2 of Usui Reiki. There are different ways one may have to manage this condition. However, having a doula by your side can be very comforting, as we are trained to be there for our clients so they are as comfortable and relaxed as possible. Reflexology. This practice should really be avoided unless it is okayed by their medical professional. However, if suffering from high blood pressure, reflexology can still be beneficial. If suffering from hypertension before becoming pregnant, that's the big thing there, before becoming pregnant, reflexology can be beneficial at supporting the body to leveling out that pressure. Reiki. Energetically, this condition is associated with not getting one's needs met. You may sense a feeling of being less loved, helpless, and may even feel less attractive. Some questions one may want to consider if they've been diagnosed with this condition are: how are things at home? With the partner, at work, with family? Is someone or something making your blood boil? Is there something you may be hanging on to and not letting go of? Reiki can help to clear away these energetic blockages that we sometimes hang on to, and Reiki can restore the ki, or sometimes known as chi. So this is the life force energy within us. To look at some different images of life force energy, I would highly suggest looking up and doing some research on Kirlian photography. Not only are the pictures beautiful, but it really does show you the life force energy of objects. Decreasing the risk of developing preeclampsia. To decrease the risk of developing this condition, it takes just a bit of change to your daily routine. Try to exercise for at least 30 minutes each day. Try different relaxing techniques to remove stress, such as reflexology. Sleep and rest as much as possible. It is very important. Try meditation to help lower stress. Now, I do understand when it comes to meditation, a lot of people find they struggle with this. Now, my theory on meditation is, it's just like it's something new. If you've never done it before, it takes practice. So a good analogy of this is when we are young and learning to ride bikes, we need our training wheels and we need to practice before we can actually take those wheels off and perfectly ride that bike without getting a scraped knee. Well, meditation is basically the same. I mean, the more you practice at it, the better you are going to get. It just takes a little bit of practice. You may also want to try to soak in as much vitamin D as possible. So get out there on those nice sunny days, take a walk, go play in the garden if you have that opportunity, and really soak in the sunshine. Nutritionally, continue taking prenatal vitamins, eat some chocolate, load up on fiber and antioxidant-rich food, eat more garlic and beets, and follow the brewer's diet and eat healthy salts. Thank you all for taking the time to watch this video on preeclampsia. My goal as a full spectrum holistic reproductive practitioner with these videos is to bring more awareness to all these different conditions that we can experience, throughout pregnancy or even just day to day. So make sure to subscribe to my channel, as I'm going to be making more content and videos to help bring awareness. Make sure to also like this video and share it to help spread that awareness. I truly believe that we don't know enough about our bodies. When I first took this course as a full spectrum holistic reproductive practitioner, I was shocked at how little I knew. And so that is why I have made it my goal to try to spread some awareness. Anyways, again, like and subscribe. And also, if you would like to try out a reflexology or Reiki session, or maybe you are interested in having a doula for your pregnancy, or maybe you just have some questions about it, check out my website, Holistic Health, Trust, Allow, Flow. All you have to do is scan the little QR code there, and it'll take you right to my website, where I've got all kinds of information on doulas and reflexology and Reiki, but you can also book your very own session with me if you are interested. Again, thank you all so much. I really appreciate everyone taking the time to really, learn about these different conditions and help to spread that awareness.